Hello friends, today we are discuss about axillary artery. The axillary artery is the principal artery supply of the upper limb. It is a continuation of the subclavian artery. Can you see in the diagram? This is a subclavian artery, the axillary artery which is a continuation of the subclavian artery. It begins from the outer border of the first rib to the lower border of the teres major muscle. Now the division. The pectoralis minor muscle crosses in front of the axillary artery and divided it into three parts. First part from the lateral border of the first rib to the upper border of the pectoralis minor muscle. And second part lies behind the pectoralis minor muscle. Third part from the lower border of the pectoralis minor to the lower border of the teres major muscle. See in the diagram, this is pectoralis minor muscles which divides the axillary artery in the three parts. This is the first part, this is the second part which is behind the pectoralis minor muscle, and the remaining is this is the third part. Now let's see the branches. The axillary artery total gives the six branches. The one branch from the first part, and two branches from the second part, and three branches from the third part. Let's see the first part branches. Superior thoracic artery, which arises near the subclavius muscle, supplies to subclavius, pectoralis major, and the minor medial wall of axilla. Now let's see the branches of the second part. There are two branches from the second part. First is thoracoacromial artery, emerges at the upper border of pectoralis minor, immediately break up to terminal branches, pectoral, deltoid, acromial, clavicular branch. You can remember these four branches of the thoracoacromial artery is cadaver or dead people. The C of the cadaver, which is clavicular branch, R is acromial A, and a dead deltoid D, and people P, which is pectoral. Next, the lateral thoracic artery emerges and runs along inferior border of pectoralis minor, supplies to pectoralis muscle, serratus antral muscle, also supply to breast on female. Now let's see the branches of the third part. There are the three branches from the third part. The subscapular artery, largest branch among these, run along the lower border of subscapularis muscles, gives a large branch circumflex scapular artery that runs along the lateral border of scapula. Anterior circumflex humeral artery passes in front of surgical neck of humerus, anastomosis with posterior circumflex humeral artery to form arterial circle. Gives all ascending branches to supply head of humerus and shoulder joint. Posterior circumflex humeral artery passes backward the surgical neck of humerus to form anastomosis. It supplies deltoid muscle and shoulder muscle. Just remind all these six branches, like you have to remember the Saint, the Lord, to say a prayer. Saint, the S from the Saint is the superior thoracic artery. The T from this thoracoacromial artery. Then Lord, lateral thoracic artery. Then say S, subscapular artery, anterior circumflex humeral artery, and P from prayer is posterior circumflex humeral artery. Let's see in a diagram. This is a pectoralis minor muscle which divided the axillary artery into three parts. First, second, and third. This is the branches. Now see the first branch from the first part. There is a superior thoracic artery. Now from the second part, there is a thoracoacromial artery and a lateral thoracic artery. And now from the third part, there is a three branches. subscapular artery, anterior circumflex humeral artery, and posterior circumflex humeral artery, which anastomosis to the neck of the humerus. Now, all these are the branches of the axillary artery. Now, the relation. Relation of the first part. Anteriorly, pectoralis major and the skin, the cephalic vein crosses the artery. Posteriorly, the long thoracic nerve to serratus anterior. Laterally, the three cord of the brachial plexus. Medially, the axillary vein. Now, the relation of the second part. Anteriorly, the pectoralis minor, the pectoralis major, and the skin. Posteriorly, the posterior cord of brachial plexus and the subscapularis muscle and the shoulder joint. Laterally, the lateral cord of brachial plexus. Medially, the medial cord of brachial plexus and the axillary vein. So, this is all about the axillary artery. Hope you understand the axillary artery. Thank you.